Now we know from research that young people generally handle COVID-19 better than the elderly in terms of its health impact. But research shows that more than half of South African students have experienced some sort of psychological distress. In fact, it shows that more than 65% of students experienced mild to severe distress during their academic year last year in 2020. The findings are contained in a report titled "The Social Impact of the COVID-19 Pandemic on Youth in the Post-School Education and Training Sector in South Africa." So to discuss, we're joined by the CEO of Higher Health, that's Professor Ramneek Ahluwalia. Professor, thank you for being with us. So this isn't only about the health toll, but the psychological toll. How surprising, how worrying is this research that more than half of students had some sort of distress last year?
See, actually, we're not surprised with the findings, though. We anticipated those findings to come in. But I think the most important part, Francis, is that, there's been so much of research around the old people and the impact of COVID on old people or middle-aged or people with comorbidities. And there's been very little spoken about its impact on the youth. And I think this research brings into the light that youth plays a very central role in the whole configuration of the COVID-19 pandemic. And why I say so is predominantly because youth are the carriers of this virus in predominance. The virus actually does not differentiate between an old and a poor. As long as you are a human body, it will like to move from one person to the other. But young people, because they congregate, they are mildly symptomatic, they are asymptomatic, they carry the virus very quickly.
Yeah.
Now, we are trying to see from the study is now a 360 view of impact on the youth. The same youth are losing their parents, grandparents, the same youth are seeing bereavement in their families at such a young age. The same youth have parents and guardians who are losing jobs. Same youth have very difficulty in challenges of study time due to the entire COVID and the whole academic year being disrupted. The same youth is being impacted to the fact that, devices or data and finding ways to pass in the exams. So there's so much of happening, and the results clearly indicate towards very much around every parameter, right from electricity, data, emotional distress, food, and many other parameters that are affecting the youth in totality.
And obviously the health feeds into psychological distress, or the financial issues lead into that. It is stressful, though, if I play devil's advocate here, being a student in the first place. It's a hard time of life for many. Have you gauged what's been happening in other years, for example, to compare and see how bad this is actually?
See, mental health has been a pandemic in the higher education. Suicide remained our second biggest cause of death among young people. And that's was the reality. What has happened with COVID is just exacerbated to, if not double, then quadrupled now. And that is what we are seeing. The figures of 65% is quite high, where we used to see a 25% in our average results of impact of mental health on young people in general, on moderate to severe anxiety or moderate to severe depression. And I think what 65% is trying to emphasize is that the amount of stresses that COVID has brought, the whole holistic approach that the COVID has brought has massively impacted the youth of this country. And I'm worried about 5-10 years from now, when the same youth is going to become an adult to take up the whole responsibility of our country's economy forward. And this is the generation we need to be harnessing very well. So I think this is very challenging times, and not a surprise, but a huge chapter of alarm for all of us, and to be making people aware.
Yeah, and could you extrapolate and think, okay, if post-matric students are suffering, what about the children at school who are bearing this brunt, often not able to deal with it even?
So I'm going to use your medium to market a number, 0800-363636. This is a toll-free mental health crisis helpline of Higher Health. 24 hours, totally free, whether it's 3 o'clock, 2 o'clock. This is a very difficult time. So you'll find a psychologist, you'll find social worker, you'll find a counselor, you'll find help. We are not so proud to declare that we have averted about 15,000 severe crises in just the last 6 months. But I think we are hungry for more now. The reality is this data is clearly indicating this much more deeper problem. We've got about 2.5 million youth in the post-school system. And through your channels, we want to reach out to every one of them and to say, should you find yourself in distress, you find yourself, do not take a difficult decision of your life. Speak to someone, talk to someone, get counsel.
Yeah.
And this is not just one phone call. These are 9 to 10 calls that takes about 3 to 4 days to avert a crisis and then link them to a long-term therapy or a care. So I think these are difficult times, and such numbers will only assist our population.
All right, Professor, before you go, please repeat that number, and we're going to bring it up on screen. Repeat that number, and also, in finality, what can we do? I don't know, it's so difficult. As a country, as people, with young people in families, to support them, because you can't lie. This is a global pandemic, it is stressful, but you don't want young people carrying this burden unduly.
So I repeat the number again. It's 0800-363636. And I'll repeat it again should you want it, Francis. But your question is absolutely very deep, actually. And my answer is that we need to form a social compact between, it's just not only the responsibility of government, private sector needs to play its role. It has to come, look at employability chances, opportunities, trying to make connectivity more simpler, trying to find more means of providing foods to the youth who are really hungry and whose parents and guardians are really in distress at this moment. Families are grieving at the stages. So it's about social compact of us all uniting together under a common enemy, which is COVID-19. There's no other enemy at this stage for us. And one more notion is to say young people are not immune to COVID. So young people are also dying because of COVID. The new variants have shown high affinity to young people. We have recently seen a death of a student just because of complications of COVID. India and Turkey, recent pandemics have realized how many young people actually died of COVID and its complications. So yes, young people comparative to old and middle age are far less seriously affected by the pandemic in particular, but they play a very, very significant role. The major outbreaks actually happen at our residences, in our universities, in our colleges, because that's where congregation of young people are. The Balita Rage Party, that's where the second wave started. So we need to watch out we need social compact with young people, plus we need to work with young people. And the only way we can defeat this virus is young people join hands with us. So it's a 360 view of how we need to work with young people at this stage.
All right, so sad about the mental toll of COVID-19 on young people in South Africa. We have brought that number up on the screen. Please use it if you need to, 0800-363636. Thank you very much, Professor Ramneek Ahluwalia, CEO of Higher Health.